Single photon emission computed tomography. Single photon emission computed tomography SPECT differs from other types of tomographic radiologic imaging such as CT or conventional radiography, rather than passing X-ray through a patient to form an image. The patient is injected with a radiopharmaceutical, and the patient emits radiation in the form of a gamma rays or X-rays, which are detected by gamma camera. Multiple views of the patient are acquired and subsequently reconstructed into a series of slices through the patient to provide a 3D representation of the in vivo radiopharmaceutical distribution. How does SPECT scan work? A SPECT scan integrates two technologies to view your body: computed tomography and radioactive material tracer. The tracer is what allows doctors to see how blood flows to tissue and organs. Before the SPECT scan, you are injected with a chemical that radio-labeled, meaning it emits gamma rays that can be detected by the scanner. The computer collects the information emitted by the gamma rays and translates them into two-dimensional cross-sections. These cross-sections can be added back together to form a 3D image of your brain. The radioisotopes typically used in SPECT to label tracers are iodine-123, technetium-99, xenon-133, thallium-201, and fluorine-18. These radioactive forms of natural elements will pass safely through your body and be detected by the scanner. Various drugs and other chemicals can be labeled with these isotopes. The type of tracer used depends on what your doctor wants to measure. For example, if your doctor is looking at a tumor, he or she might use radiolabel glucose FDG and watch how it is metabolized by the tumor. The test differs from a PET scan in that the tracer stays in your bloodstream rather than being absorbed by surrounding tissues. Therapy limiting the image to areas where blood flows, where SPECT scans are cheaper and more readily available than higher resolution PET scans.
How do I prepare for a SPECT CT scan? No extra preparation is required. It's important that you let staff at the hospital or radiology practice where you're having the scan done know if you are or think you could be pregnant or at breastfeeding. This study may not be suitable for pregnant women because of the radiation dose to the growing fetus. Please discuss this with your doctor. Women who are breastfeeding and people who are primary or sole carrier for small children may need to make special preparation for after the test, to stop breastfeeding for a short time and to avoid close contact to young children. This is due to the small amount of radioactivity your body may release for a while after the test. Talk to your referring doctor or the nuclear medicine practice where you will have the test for details. The Australian Radiation Protection and Nuclear Safety Agency has recommendation about breastfeeding and close contact with children after nuclear medicine tests. What are the benefits of a SPECT CT scan? SPECT CT provides the ability to merge and combine the images, often allowing the nuclear medicine specialist to more accurately pinpoint the site of abnormality on your nuclear medicine scan. This may be of particular importance in certain clinical situations, when the interpretation of an area of interest may change depending on its location. For example, in small areas like the spine or feet, it is sometimes hard to determine the nuclear medicine imaging alone whether the abnormality lies on the bone or on the adjacent joint. Fusing a SPECT with CT provides adding confidence in identifying where the abnormality is. What are the risks? The amount of radiation your body is exposed to is less than you received during a chest X-ray or CT scan. Women who are pregnant or nursing should not undergo a SPECT scan. Why it's done? The most common uses of SPECT are to help diagnosis or monitoring brain disorder, heart problems, and bone disorders. SPECT can be helpful to determine which part of the brain are being affected by dementia, clogged blood vessels, seizures, epilepsy, head injuries. Heart problems. Because of the radioactivity tracers highlights areas of blood flow, SPECT can check for clogged coronary arteries, and the arteries that feed the heart muscle become narrowed or clogged. The portion of heart muscle served by these arteries can become damaged or even die. Reduced pumping efficiency. SPECT can show how completely your heart chambers emptying during contractions. Result of the SPECT CT scan. The SPECT CT imaging will be reported by the nuclear medicine radiologist, and the report will be forwarded to the referring doctor thereafter.
بسم الله الرحمن الرحيم. قام كاميرا أداء الطالب فهد جابر اسمري محمد مساعد الشمري. التعريف definition. قام كاميرا also called a scintillation camera as a device used to image gamma radiation emitting radioisotopes, a technique known as scintigraphy. The application of scintigraphy include area drug development and nuclear medicine imaging to view and analyze image of human body. The technique. Scintigraphy is used of gamma camera to capture emitted radiation from internal radioisotopes to create two-dimensional image. SPECT, as known as single photon emission computed tomography. Imaging as used in nuclear cardiac stress testing as performed using gamma cameras. Usually 1, 2, or 3 detector or heads are slowly rotating around the patient's torso, as you can see in the
بسم الله. شرح نتكلم عن construction of gamma camera. A gamma camera consists of one or more flat crystals planes or detectors optically coupled to an array of photomultiplier tubes in an assembly known as a head mounted on a gantry. The gantry is connected to a computer system that both controls the operation of camera and acquires and stores images. The construction of gamma camera is sometimes known as a compartmental radiation construction. The system accumulates events or counts of gamma photons that are absorbed by crystals in the camera, usually a large flat crystals of sodium iodide with thallium doping in a light-sealed housing is used. Continue of construction. The crystal scintillates in response to incident gamma radiation. When a gamma photon leaves the patient who has been injected with a radioactive pharmaceutical, it knocks an electron loose from an iodine atom in the crystal, and a faint flash of light is produced when the dislocated electron again finds a minimal energy state. The initial phenomenon of excited electron is similar to the photoelectric effect and the Compton effect. After the flash of light is produced, it is detected. Photomultiplier tubes يرمز لها بالرمز ال PMT behind the crystal detected the fluorescent flash and computer assumes the count. The computer reconstructs and displays a two-dimensional image of the relative spatial counts density on a monitor. This reconstructed image reflects the distribution and relative concentration of radioactive tracer elements present in the organs and tissue imaged.
Cyclotron. Cyclotron is a type of a particle accelerator that charges the particle outward from the center along a spiral path. How does it work? A cyclotron body consists of electrodes called Ds because of their shape in a vacuum chamber. This vacuum chamber is flat and sits in a narrow gap between the poles and of a large magnetic which creates a perpendicular magnetic field. A stream of the charged particle is fed into the center of the chamber and high-frequency alternating voltage is applied across the electrodes. This voltage alternately attracts and repels the charged particle, causing them to accelerate. The magnetic field moves the particle in a circular path, and as they gain more energy from the accelerating voltage, they spiral outward until they reach outer edge of the chamber. As we see in the picture on the downside, we have in the middle the two Ds. We call it D1 and D2. In the middle we have the particle source. The magnetic field is a perpendicular. The particle source have a negative charge, so the D1 will take the negative, D2 will take the positive charge. The negative will push the particle into the positive, then it will alternate. The D2 will take the negative and D1 will take the positive. So the D2 will push the particle into the D1 in the circle way until it reaches the cyclotron in medical. Medical cyclotron produce a proton beam in which are used to manufacture radioisotopes used in medical diagnosis. Radioisotope produce a cyclotron decay by either positron emission or electron capture, positron emission tomography PET, and a single photon emission computed tomography SPECT, which utilize the gamma ray associated with the electron capture. Are two imaging technique they rely on the cyclotron procedure radioisotopes.
الراديونيوكليسايد بروديوسد from a cyclotron. 4 مواد مشعة يتم إنتاجها من خلال السايكلوترون. أول هذه المواد المشعة هو الثاليوم 201 which have half-life around 3 days and energy around 70 كيلو إلكترون فولت ويستخدم في اختبارات الكارديك سكان. ثاني المواد المشعة هو الجاليوم which have half-life around 3.2 days and energy around 1930 كيلو إلكترون فولت ويستخدم في اختبارات الجاليوم سكان. ثالث المواد المشعة هو الأيودين 123 اللي يكون عمر النصف الخاص فيه هو 13.3 ساعات والطاقة 159 كيلو إلكترون فولت ويستخدم في اختبارات الثايرويد سكان. آخر المواد المشعة هو الأنيديليوم 111 which have half-life around 2.8 days وطاقة خاصة فيه 174 كيلو إلكترون فولت ويستخدم في الأنيديليوم لايكوسايت إيميجينج الخاص بتصوير الكريات الدم البيضاء.
Radionuclide generator. What is a radionuclide generator? Radionuclide generators are devices that produce a useful short-lived medical radionuclide known as a daughter from the radioactive transformation of a non-medical long-lived radionuclide called a parent. By having a supply of parent on hand at a facility, the daughter is continually generated on a site. The generator permits ready separation of the daughter radionuclide from the parent. Once separation occurs, the generator starts generating more daughter that can be again separated in sufficient quantity at a later time. Why do we need a radionuclide generator? Short-lived radionuclides are often the agent of choice in nuclear medicine because they permit the use of amber radioactivity while keeping the absorbed dose to the patient within acceptable limits. In general, however, the use of short-lived radionuclides initiates many problems that stem from their fast decay. For example, The time available for processing, transportation, storage, and dispensing is very limited and is often insufficient to assure quality in labeling and in radionuclidic purity. A generator solves some of the problems associated with the transportation of short-lived radionuclides. Thank you.
Radionuclide. What is radionuclide? It is a radioactive form of elements, are called radionuclides. Some occur naturally in the environment, while others are man-made. Every radionuclide emits radiation at its own specific rate, which is measured in time of half-life. Radioactive half-life in the time required for half-life of the radioactive atoms present to decay. Radioactive decay is when every radionuclide emits radiation at its own specific rate, which is measured in terms of half-life. Radioactive half-life is the time required for half-life for half of the radioactive atoms present to decay. Radioactive decay is where a radioisotope transforms into other radioisotopes. This process emits radiation in some form. Some radionuclides have half-life of more seconds, but others have half-life millions of years. How we can reduce radionuclides? The use of short-lived radionuclides have grown because large doses of these radionuclides can be administered to the patient with only minimal radiation dose and produce excellent image quality. This increasing appreciation of short life. Radionuclides have led to the development of radionuclide generator that serve as converter source of their production.